And so public health, as we have been throughout, continue to follow these numbers, follow the trends, follow things like test positivity, vaccine rates, the strain on the healthcare system. We see, still reporting these deaths, which are tragic. Still reporting increasing number of outbreak announcements. And so we are continuing to review what our next steps could be. And I can certainly assure you that stronger restrictions are an option. I'm not going to speculate on what those might be precisely at this point. When the decision is made, we will be announcing them as we usually do. And we know that there are certain portions of our population who are not yet vaccinated, and some who may not be ever interested in being vaccinated. We see the great proportion of the severe outcomes are in these unvaccinated groups, and it's tragic. It's heartbreaking. Where these are our fellow Manitobans, and so we're doing whatever we can to protect all Manitobans, protect our healthcare system as well for all Manitobans. So we're doing whatever we can to try to reach these individuals, try to get as many people vaccinated. We're still vaccinating people, so we still are making progress, but we want to do that faster. We see that the vast majority of severe outcomes are in the unvaccinated. We just don't want to see Manitobans or our fellow Manitobans fall ill with this. So we're going to continue to try to reach out to those groups, and we're going to continue to have public health restrictions in place to protect Manitobans, including those groups, from the severe outcomes. And with that is protecting the healthcare system, so it's there for all Manitobans for all of their needs. So it's obviously quite disappointing to be once again in this situation when we've known for quite some time now what we all need to do to limit the transmission of this virus and certainly limit the risk of severe outcome. So public health, we're going to continue to encourage all Manitobans to follow the public health orders, follow those fundamentals that we've been speaking about for so long, staying home when sick, hand washing. And really, anyone who's interested in seeing an end to these restrictions, if you haven't already, get vaccinated as soon as possible. And of course, to the vast majority of Manitobans who have been vaccinated, who have been following our advice all along, thank you. We're going to continue to rely on your patience and your work to try to end this pandemic. And it's disappointing and frustrating, I know, to me and to all Manitobans, I'm sure, to have this renewed talk of further restrictions. We've been at this for so long. But we're going to need to ask Manitobans for their further adherence and further cooperation as we navigate this fourth wave. Like we've said many times, the only way through this is together. So with the opening of the US-Canada border, Manitobans are likely thinking of traveling out of province, especially over the winter break. So again, we still have to be cautious with our non-essential travel, know those destinations, know the requirements of those destinations. Certainly, I advise against non-essential travel to those who are unvaccinated or at increased risk of severe outcomes. But if you choose to travel, be sure you know the requirements upon your return to Manitoba. You should, understand the requirements of where you're going for sure as well. So if your travel is within Canada, domestic travel, there are still some self-isolation requirements for individuals returning to Manitoba. So more information on that, manitoba.ca, self-isolation for asymptomatic returning travelers and testing for travelers on those various pages. But essentially for domestic travels, if you're fully immunized and 2 weeks have passed, you're exempt from needing to self-isolate upon return. And that's obviously if you're asymptomatic. And those children that are under age 12 that are traveling with fully vaccinated individuals are also exempt. So remember, if your travel is outside of Canada, you need to pay attention to health or the government of Canada's rules on this. So that can be found at canada.ca. So international travelers must follow the federal self-isolation requirements. So ensure you know which apply to you. And in that, for international travel, unvaccinated children under 12 without symptoms and traveling with vaccinated parents or guardians are not allowed to attend school, camp, or daycare for 14 days upon return to Canada. So those are the Canadian guidelines. So I'm sure you're familiar yourselves with that if you are traveling internationally. If you're staying back, please review the holiday and celebration information to enjoy seasonal activities in a safe manner, and continue to update yourself if further public health requirements are in place. So thanks again. I'm going to return it over to Dr. Reimer.
Thank you, Dr. Roussin. Good afternoon, everyone. I'm Dr. Joss Reimer, medical lead of the province's Vaccine Implementation Task Force. So I have been providing regular updates to Manitobans about when we are recommending third doses of the COVID-19 vaccine. And at first, those criteria were fairly limited. They were focused on the people who were most at risk of severe outcomes or who were most likely to be at risk of coming in contact with the virus. And today, we're announcing that most adults over the age of 18 will be able to receive a third dose of a COVID-19 vaccine. Some important pieces to flag, though, are that it has to be at least 6 months between your second and third dose. So I ask that people keep that timeline in their mind when they're thinking about booking. But for those who haven't hit the 6-month mark yet, you can start to think about whether or not a booster makes sense for you and start making plans to receive your third dose. So for most people, the third dose must be given that minimum of 6 months after the second dose. There are some very limited circumstances where the dose can be given earlier. In those cases, a prescription from a doctor would be required if you are requesting your third dose earlier than 6 months, because you are moderately to severely immunocompromised, or because you require it for travel purposes. Individuals who are unsure of the date of their last immunization can check their records online. This is consistent with Health Canada's approval for the use of a booster dose of Pfizer vaccine for people over age 18 to be administered at least 6 months after completing their primary vaccine series. And while this third dose is now an option to all adults who are at least 6 months past their second dose, I want to be clear that from a public health perspective, there are some groups of people where we would go one step further to actually recommend that booster. So there are several groups of people who are most important to think about when it comes to getting a booster. So that's people who are over age 70 because they received their vaccines earliest and may have a smaller immune response, people who are immunocompromised, Indigenous people living anywhere in Manitoba, people who have certain chronic health conditions, and frontline healthcare workers. So for example, in the healthcare sector, frontline workers in healthcare facilities and congregate care facilities were among the first people in Manitoba to be vaccinated. This is because healthcare workers are in close contact with vulnerable people, many of whom are already sick or are elderly and have weakened immune systems. So this means that our healthcare workers are both at a higher risk of exposure and a higher risk for their own health, but they also present a higher risk to vulnerable Manitobans if they were to pass on the infection to their patients. If you are a healthcare worker and were among the first to be vaccinated, your immune protection today may be lower than other people in Manitoba. This doesn't mean that healthcare workers have no protection after 6 months, but their bodies, their immune system, their ability to fight off the virus could benefit from a boost once they hit that 6-month mark. So we're updating our clinical guidance to reflect our recommendations. So we're highlighting that while a third dose is available to anyone 6 months after their second dose, that it is recommended and particularly important for certain higher risk groups, as well as their close contacts or caregivers. So getting a third dose or a booster can help strengthen your body's immune response to the vaccine and therefore to the virus. At the same time, it's still very important to be cautious, especially as we hear the numbers that Dr. Roussin was just sharing, that we want to minimize your risk and exposure to COVID-19 by following the fundamentals. A third dose works the same way that the first dose and the second dose worked. When the vaccine enters your body, it triggers your body to produce a strong army of virus-fighting antibodies and some longer-lasting immune cells. This army of antibodies provides protection against becoming infected and provides protection against severe outcomes if the virus does enter your body. Over time, the army of antibodies protecting you from COVID-19 can become weaker. And this is not unexpected. It happens with every immune response, whether that immune response is due to a vaccine or an infection. The data specifically on the COVID-19 vaccines is still emerging, and we're learning more about it. What we know today is that young and healthy people remain well protected against severe outcomes, even 6 months after their second dose. But for older Manitobans, for those with significant health concerns, data from the UK and the US have started to show that their originally high level of protection against severe outcomes does decrease over time. Immune responses don't always last forever, and then that's regardless of whether it's due to a vaccine or an infection. And how long they last can vary from person to person. Some people have stronger immune responses than others, and that can be affected by age, health conditions, and many other factors. With COVID numbers on the rise in this fourth wave, and with an increase in breakthrough cases among those who received first and second doses, a third dose is an option to offer you additional protection, both for you and for the people around you. So if you are elderly, have significant health concerns, or you're a close contact to someone who is elderly or has significant health concerns, we recommend that you boost your immune response once you hit the 6-month mark. It's clear, based on studies from around the world and what we're seeing in our own province, that vaccination works incredibly well to prevent you from getting COVID-19, to prevent you from having severe infections if you do get the virus, and prevent you from passing it on to others. Right now, a combination of waning immunity for some individuals and too many people who are still unvaccinated is a health risk that we want to avoid as much as possible. Research mostly from Israel, but somewhat also from the study done by Pfizer, shows us that the third dose is very similar to the second dose as far as side effects and risk. So with that, we are recommending you receive the same mRNA vaccine as your second dose, but either Pfizer or Moderna is acceptable if the other is not available. Please be aware that if you attend a vaccine clinic and 6 months have not passed since your last dose, you will be asked to come back at the 6-month mark. And this is because research has shown, both for this vaccine and for many others, that a longer window between the end of the primary series and the booster dose provides the strongest immune response possible. Your immune system needs time to complete its immune response before the next dose if we want that reminder to be as effective as possible. So while it might seem like it's better to get the booster as soon as possible, waiting 6 months will actually provide you with better protection. If you're feeling unsure about receiving a third dose, your primary care physician can help you to better understand your individual circumstances. You may want to think about things like, are you at risk of exposure or severe illness from COVID-19? Were your first 2 vaccine doses administered closely together? How long has it been since your last dose? We also saw that Manitobans who are Black, Indigenous, or people of color experienced more severe outcomes from COVID infection than the general population. So this also should be considered as you make a decision about your third dose. And we talked a little about this already, but you may be wondering about whether or not the third dose poses a greater risk of adverse reactions than the first or the second dose. We know that the vaccines are safe and effective, but rare side effects have been reported. So if you're a younger person, particularly if you're male, who might be at greater risk of myocarditis from the vaccine, you could have a conversation with your healthcare provider to weigh that against your individual risk of being exposed to COVID and your individual risk of having severe outcomes compared to your risk of developing myocarditis from the infection and from the vaccine. So to summarize, the first topic in today's announcement is that Manitoba is moving away from using eligibility criteria to restrict who can and cannot receive a booster dose. Instead, everyone over the age of 18 who received their second dose 6 months ago or longer is now able to book an appointment online or through the province's call center, or to contact your primary care physician or pharmacist to talk through any concerns you may have. However, Public Health has developed clinical guidance about who should receive a booster dose, and that is available on our website. I want to be clear that even though we are now recommending booster doses for many people, our top priority remains to immunize everyone who has yet to receive their first and second doses, because we know that the largest increase in protection comes from that primary series. Moving on to another topic, some Manitobans have expressed interest in the Janssen or the Johnson & Johnson vaccine. We recently heard from the federal government that it will be arriving in Manitoba next week. So we will share more details soon about where and when the Janssen vaccine will be available. What I can tell you today is that the plan is for it to be available at a selection of our medical clinics and pharmacies. Please keep in mind that the clinics and pharmacies do not have any Janssen vaccine right now. So you don't need to call them to get the vaccine just yet. With Janssen, individuals currently are considered fully immunized 14 days after receiving their single dose. However, as data evolves, it is possible that this could change in the future. And regardless of how we define someone as fully vaccinated, we recommend a second dose of an mRNA vaccine be given to provide the best protection possible. Thank you, and we'll now take your questions.
Thank you, doctors. A reminder to our reporters on the line, you will have one preliminary and one follow-up question to begin. Up first from CJOB, Skylar.
Hi, doctors. Dr. Reimer, my first question's for you. I know you did you were quite extensively trying to explain the difference between the recommendation and the eligibility of that third booster shot, but I know a lot of people will see, hey, I'm a Manitoban and I'm over 18. Should I go get this shot? And it sounds like you really have to kind of weigh your own risk to the virus at this point.
Yeah, that's exactly it. So we're trying to shift this to be more similar to how we do the influenza program, for example, where while anybody can get the influenza vaccine, we do have clinical guidance around who it's most important for. And so the same thing here, we don't want to restrict people who, due to individual risk factors, might not fit perfectly into the recommendations. But we also want to make sure that people know when it's recommended. So that's for elderly individuals, for people who have one of the health conditions that'll be listed on the website, for healthcare workers. All of those folks are really recommended to get a booster shot, but it is available to Manitobans 6 months after their second dose if they do that personal assessment to determine that their risk and benefit ratio makes sense to get that booster dose.
Great, thank you for that. Dr. Roussin, second one for you. I was at the Jets game last night, and mask adherence is not good, period. It's not. I think in my row, there were probably 2 people wearing their masks correctly. These folks are on TV, you know, and a lot of people are getting together. And I think a lot of people see that adherence, and then it kind of trickles down into other areas of our society. So is the province working with True North to make sure adherence is better? And what is the risk of getting COVID-19 at a Jets game? Because a lot of fully immunized people are getting infected right now, and I'm wondering if that's one of the spots where they're getting it.
Yeah, and so, you know, just like many of the public health restrictions and advice are part of that multifaceted approach to reduce risk, right? It's very difficult to eliminate risk, and then we certainly balance it with other things. So even though that's a fully vaccinated entry, we do require the use of masks when not actively eating or drinking. And then again, it's just an added layer of protection in an already a protected area, because we do mandate a vaccine. So in areas like this, again, it's difficult sometimes to assess adherence, because if you're actively eating or drinking, then of course you can bring that mask down, but it should be put up when not actively engaged in eating and drinking. And so just like any other venue or any other we want full compliance with that. And so, like I say, in these areas, sometimes it's difficult to judge, but we certainly ask all Manitobans to continue to do their part to reduce the risk of transmission, and that's those fundamentals, and then of course adhering to the public health restrictions.
From the Winnipeg Sun, Josh.
Good morning. Dr. Reimer, my first question's for you. When you talk about third doses, how many third doses have been administered so far in Manitoba, and how much capacity do we have in terms of giving out third doses, especially when we're still working on first and second doses? Where are we standing at in terms of that stock?
I don't have the number of third doses in front of me. I'll see if, while Dr. Roussin's answering a question, if I can find that quickly for you. If not, then if you can email our comms folks, they would be able to see what we can find for you. As far as our capacity, we're working together with the physicians and pharmacists to ensure that people have many different options available to them that are convenient to get this third dose. And we are trying to shift towards more of our normal rollout, which is typically done with physicians and pharmacists. But we will ensure that the public health clinics are available as well. And we don't anticipate any major concerns around capacity with all of those channels running together. That said, there's going to be a lot of people who hit their 6-month mark right at the end of this year. And so we're going to work hard to make sure that we're planning for that and that we have all of these channels up and running efficiently to be able to meet the demand when the majority of Manitobans start to hit the 6-month mark.
All right. Thank you. My second question is for Dr. Roussin. You say you don't have a lot of details on upcoming restrictions, but are we looking at additions to the need for the proof of vaccination, or are we talking about potentially putting new capacity limits on businesses or churches or other sectors? What's kind of on the table? What are we looking at when it comes to these new restrictions rolling back in?
Yeah, and so we don't have those details to announce today. So we are looking at all aspects. All the type of things that you mentioned are all possibilities, and we're working on what's what we think is going to be the most effective, and then balancing that with the impacts of those restrictions. And so when we do have details on that, we will be announcing it.
From CBC Radio Canada, Charles.
Hi, good morning. First question I have for you, with the number of cases of COVID-19 increasing and children under 12 years of age not being vaccinated, are there plans to have stricter measures in schools for this age group to avoid the risk of transmission?
So we do see a significant proportion of the cases now being in those younger age groups. Of course, we don't see a lot of severe outcomes, which is good, but we know they're part of transmission chains, and so they transmit to people who could be a lot of risk. So certainly they themselves are not at zero risk. I mean, there is risk to anyone who acquires COVID, but there's also significant risk as being part of that transmission chain. So we know that schools, we've always prioritized schools. We know that that's so important to the mental health and well-being of kids. So we want to do whatever we can to keep as many kids in school, of course, as safely as possible. So we have a lot of measures in place right now, masks, certain things related to distancing and screening for symptoms. So we're going to continue to advise that. We want to do whatever we can to keep those kids in school. But again, the best way to protect those kids is to limit transmission around them, and that's high vaccine rates, and that's a number of Manitobans practicing those fundamentals. And so really that's the best way to protect that group. So we have to have measures in place to ensure we're limiting transmission in any scenario. We know with this virus, if we see high transmission anywhere, it will soon be everywhere. So so it's all all connected in that realm.
Thank you. And second question I have for you, Dr. Roussin. The new premier, Stephenson, she said she didn't want any strict measures or a big reconfinement. So I would like to know, is it still part of the plan of public health? And do you think you have the support of the new premier?
So I mean, we've worked, work alongside government throughout this and many partners, right? And so we know that our, Public Health Act and the restrictions under emergency orders, require elected officials to have the final say on many of the restrictions that we've implemented so far, and that's how it should be in a democracy. So we've always been working alongside each other, always working for the best interests of Manitobans, and that's continued.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. You say you're looking at things. Right now, Manitoba has overtaken BC and Alberta. We're now number 2 in the infection rate in Canada, behind only in the provinces, Saskatchewan. We'll be number 1 in a day or two because Saskatchewan's cases are dropping. We have, if you look at the trajectory, we are just a little bit off the rate of growth that we saw right before the second and third wave got really, really, really bad. You see the really high test positivity rates in some regions. What are you waiting for?
So, I mean, we haven't been waiting. We've had measures in place, and some of them very strict compared to other regions, some of the ones that you've mentioned, right? And so, of course, just simply a comparison to other regions doesn't tell the whole story, right? Because they're on their downward trend, and we haven't yet reached our upward trajectory compared to that. So, but I mean, certainly concerning. Like we said, the numbers are concerning. They've been concerning for a while. We've had measures in place. So we're not waiting to put measures in. We've had measures in. But we see, despite those measures, continued climb. So, yeah, so we are, actively working on what the response is. But that, that requires a process. And there'll be more to follow on that quite soon.
Okay, I of course meant waiting for new measures, not the existing ones we have, but I'll move on to another question. Right now we see very high COVID spread among school-age children in Southern Health. In the past, we've shut down schools when we see test positivity rates off the charts. So why are schools still open in Southern Health? At the same time, why not start rapid testing children, mandatory vaccination of kids in sports? Why not put in other measures right now for children in Southern Health?
So for schools, we've always taken that approach, right, of sort of the lasting to close, first to open. So we know the benefits of that. So I mean, there's been targeted places where we've had remote learning have to occur, where we have the outbreaks, and we'll continue to follow that. We just know that there's a huge impact on sending kids home from school. And so we have to balance that. Not that we haven't done it before, not that we haven't done it, currently. We have places that have, outbreaks where we've had to send classes to remote learning, and so we'll continue to do that. Further vaccine issues, further restrictions. Like I said, you're going to be hearing shortly from us on that.
Just before we go to Steve at Canadian Press, Dr. Reimer had part 2 of her response.
Yeah, so I'm able to answer Josh's question about how many booster doses. So the number of third doses, and before I give the number, this would include people who received a third dose because they're immunocompromised, perhaps for travel, because they received a non-Health Canada approved vaccine, or because it could be a booster dose. So for all of those reasons combined, we've administered just over 47,000 third doses so far in Manitoba.
Thank you, Doctor. From Canadian Press, Steve.
Oh, hi, Dr. Roussin. Following up on the schools question, according to government data, there have been 916 total cases in schools since September 7th, noting, of course, that doesn't mean it was obtained in school, but those are cases that have been presented in school. Why not reduce capacity, further break down cohorts? Are there not measures, short of shutting down schools and sending kids home, are there not measures that can be taken to further reduce cohorts and interactions between children?
So you're right. I mean, those numbers are, very significant. They don't indicate that transmission occurring in schools. And so, overall, throughout all the waves, we've seen transmission in schools is less than what we see in the community. And so a lot of, when we see high numbers of cases in school-age children, most times it's an indicator of high levels of community transmission, not high levels within school. Although, I mean, there absolutely is transmission that does occur in schools. But again, all of these measures, right? If we reduce the number of people in the class, and then I mean, really that's going to require that blended learning, and then so there is a negative effect. Now we have done it. And there's places now that are on remote learning because of transmission. So it doesn't mean we won't ultimately have to, but we just know there's, with the health impacts here, we have to balance it. There are health impacts to children when we take them out of school. And so we have to balance that with what we see with the transmission of COVID. And so those aren't easy decisions. And they can't be just based on an absolute number of cases that we see. So we do look at that. We've our public health restrictions are there to reduce the amount of transmission in the community, which will in turn decrease the amount of cases in school. And so really that's our best measure: get as many people vaccinated who can be, limit the interactions amongst the unvaccinated. And we'll see the transmission chains start breaking down, and we'll see those case numbers come down. Well, we've always prioritized the importance of keeping kids in school.
And given the climbing rate of numbers and the fact that it leads to further hospitalizations down the road, there's a lag there, and we're seeing this very concerning rise in numbers. Why is the province not taking steps such as limiting capacity in areas where people are fully vaxxed or are supposed to be fully vaxxed, such as restaurants and places like that, where you can go in and it's quite crowded?
So we are certainly concerned about these numbers, and for most of the reason is what you said, is the severe outcomes. So one, the effect that it has on the people who have severe outcomes and their families, right, our fellow Manitobans, but also on the impact that it has on our healthcare system. So so we do have a number of restrictions in place. We see numbers rising despite that. So so more is going to be required, and so there will be more details to come on that.
From CTV Winnipeg, Michelle.
Hi, Dr. Roussin. You keep saying soon we'll have further information soon. Is this in a couple of days? Like the current restrictions are set to expire on the 16th. Is it safe to say we'll get an update before then?
Yeah, I mean, I know that, every time we have, there's a lot of interest in the details and the timing. I just don't have that right now. So when we do have the details of what the restrictions will be, we'll announce it, and we'll announce them as soon as we can. But I just unfortunately I don't have the details on the specifics or the timing at this point.
Okay, and Dr. Reimer, I'm just wondering, could people still use super sites for third doses, or is that kind of being phased out? You said there's going to be an influx of people at the end of this year. Are you still looking at using that way of getting third doses?
Yeah, we will continue to have like vaccine-only clinics running throughout the province. So some of those will be the supersite locations. Some of them in some of our municipalities might be moving to a new location. But overall, we want to have many different options available. So, people will be able to go to the RBC center or a pharmacist or their physician, or the urban Indigenous clinics. All of those options will be available for booster doses. For people who are immunocompromised or for travel who need a dose sooner than 6 months, they can also go to all of those locations, but would require a prescription to help our staff be sure that they're following the best guidance for that individual.
From CHVN, Taylor.
Hi, good afternoon. We are seeing those cases rise. So what is that going to mean for holidays like Christmas? Restriction-wise, what should families be preparing for?
And I mean, certainly it's a concern, right? We know that we were heavily restricted last holiday season, and we want to do whatever we can to avoid that. I mean, for the most part, our restrictions right now only apply to the unvaccinated. So I'd say that people who are looking forward to a holiday season with limited restrictions, the first and foremost thing you can do is get vaccinated, and that will very likely limit the amount of restrictions you may have to adhere to. And then we'll always be dealing with these fundamentals. So people still need to be staying home when ill. We still need to be cautious about crowding indoors. But again, the most important thing right now is everyone who's eligible to be vaccinated, let's get vaccinated. Let's start adhering to the public health orders if you haven't yet been able to. And we'll see these numbers respond. And we really want to see a much better holiday season than we had to endure last year.
Thanks. And we can expect people to try to have these big holiday bashes. How is the province preparing for the increased number of cases and hospitalizations that are going to come from it?
Well, that's been an issue throughout the pandemic, right? Like ensuring that the capacity within the healthcare system is there for Manitobans, not only for COVID, but for all issues. And that's, why we've needed public health restrictions to ensure that that capacity is there. So, specifics on what preparations are being done in the healthcare system should be directed to shared health. But it's been an ongoing action since the beginning of this pandemic.
From the Winnipeg Free Press, Danielle.
Good afternoon, Dr. Roussin. If you have it, what is updated modeling showing you about our COVID-19 trajectory for both cases and hospitalizations? And if you don't have updated modeling, what trajectory are we on right now?
And so we do update aspects of the modeling, and I have seen updates on there. And so, just from us speaking about further restrictions, it's because that trajectory is in the wrong direction. We see case numbers climbing over the next number of weeks, and then just like at any other aspect or at any other time in the pandemic, increase in case numbers will translate into increase in hospitalizations and ICU numbers. And if we stay on that trajectory, if we don't do anything to change that trajectory, the modeling suggests a strain on the healthcare system would be expected.
I was wondering, what do you make of the growing number of outbreaks in healthcare settings? Can it be tied to the surveillance screening of unvaccinated staff, or do you find that cases are being introduced from the community?
That's the most likely explanation for that is what I say is that when you have high transmission anywhere, you're going to start seeing higher transmission everywhere. And so when you look at outbreaks in pretty much any setting, in schools and healthcare, those are going to increase when you have high amounts of transmission within the community. And so that's why we, when we have our public health restrictions and discuss about the fundamentals and discuss about vaccine, it's all about bringing down that community transmission. When that is high, you're going to see transmission in all places.
From Global News, Marnie.
Good afternoon. Dr. Roussin, you said you're not giving any more details on the restrictions that could be coming, but I think that word restriction might actually bring on, I guess, a lot of anxiety for people. What do you want to say to people who have been following the rules and are now maybe feeling overwhelmed that more restrictions could be coming, especially before the holidays again?
Well, it's like we said here today, is that, I mean, this is frustrating for people, disappointing, right? Especially since we know, and we've known for quite some time, what we need to do to reduce the transmission of the virus. And right now we have at our disposal for many, many months now, the best way to protect ourselves and the people around us, and that's with vaccine. And then, like I said, it's heartbreaking to still see Manitobans suffering from severe outcomes when, almost always it could have been prevented with, with simply getting a vaccine. So I think this is a very frustrating time, a very disappointing time for Manitobans. But we're left again at this place where if the trajectory stays where we think it will, we're set with overwhelming the healthcare system, and then again, and that affects Manitobans whether they have COVID or not. So we're left in that place again to start needing to use further public health measures, and I think everyone, including myself, are quite disappointed with finding ourselves here in this fourth wave. Despite having access to a vaccine.
Thanks for that. And also, there's a doctor in Saskatchewan that's been warning about a possible new type of Delta variant in Western Canada, I believe called AY25 and 27. Are you looking for that in Manitoba, and what concerns do you have about that strain?
So we, continue to sequence large amounts of the, virus from test positives here. And so, with these RNA viruses, you're always going to see these variants arise. And so you're going to see this variability in the genetic makeup. We are concerned about variants that become more infectious or more severe. And so this is early reports on here. I'm not aware that this variant is having any concerning features, but we just know that's a feature of these RNA viruses. We're going to see transmission. Wherever we see transmission, we're going to see changes in that genetic makeup. But whether it is a change that gives more severe effects to the virus is what we're concerned about. And I haven't seen that evidence of this strain you mentioned.
From the Brandon Sun, Karen.
Good afternoon. And we were just talking about, we've got three major outbreaks in Prairie Mountain Health, but Nipah, Russell, and Bonita, which has been going on for quite some time. I was just looking for maybe some kind of details, if you had any, about how they're being managed and maybe case counts.
Yeah, so sorry, I don't have any details on those. So maybe those would be probably best directed at shared health because of the healthcare institutions, but we'll be able to try to get you some information if you drop us a message.
Okay. And also just on that, well, it's obvious there's one area of this province that is generating the most, and that's of course Southern Health. Just with more talk of restrictions, wanting to know if maybe one option might be just like a regional lockdown or regional tightening of restrictions.
Yeah, and so again, we haven't landed on the details. Once we have the details, we'll be able to announce those. But I mean, transmission is occurring in all regions, and again, our main focus is protecting the health of Manitobans. And so we know that there's certain regions that have had higher transmission in the past. Our focus is because we don't like seeing fellow Manitobans fall ill. And that's our focus. So we know that we're all in this together. So if we see high transmission in a region or a sector, then that does put us at risk. But first and foremost, we should be concerned about our fellow Manitobans who are falling ill, still having Manitobans succumb to COVID-19, which can be dramatically reduced by getting vaccinated. And so we still, our focus should still be that we're in this together, and let's try to work together to get out of this pandemic. Let's try to work together to still, not overwhelm our healthcare system, so it's there for all Manitobans, and really just protect the health of Manitobans in general.
From the Winkler Morden Voice, Lorne.
Good day, Dr. Roussin. A question for you. There's been a fair bit of discussion in Morden the last while about from parents concerned about the number of students that they're seeing suddenly not turning up at school. There seems to be a concern and fear that maybe the presence of the virus in the schools is much more significant than what's reflected in the reported numbers. I'd be interested to hear what you have to say in addressing those kinds of concerns.
So, I don't have any specific information to address, a specific school, but what I would say is that what we've seen, overall is in certain situations is a decrease in the amount of testing that occurs. So we do see absenteeism without positive tests. And then so that impairs public health's ability to be able to manage things and know and have surveillance and insights onto how to manage things. Another clue to this is increasing test positivity. When we see increasing test positivity, that's usually quite a good indicator that we're missing many cases. And then a further indicator of that is we're seeing many, a large proportion of our cases that are ending up in ICU are only diagnosed upon admission to ICU. So what we're seeing is a decrease in testing overall for people who are having severe outcomes, and that's really impacting our ability to surveil the situation and manage it. So we still have that suggested stay home when ill. If you have symptoms of COVID, do still get tested. And so we can still do our contact tracing. We can still have an idea of the transmission dynamics that are occurring.
Thank you. And just one further follow-up question about in relation to contact tracing. We've had accounts from a few parents suggesting that the people doing the contact tracing haven't always been presenting a consistent message in terms of all members of a household are supposed to be isolated. They're hearing conflicting information is what we've been told. So maybe just can you reiterate what the case is right now?
Yeah, so again, speak to that. Obviously, we try to have to provide a consistent message. Sometimes the message might be different depending on the situation. But a positive case within a home almost always is going to need the household members to isolate unless they're fully vaccinated. Right now, especially in the southern health region, other than the capital region ones that have been excluded, if someone's ill at home, we want everyone to be isolating until a negative result comes back. If somebody is isolating at home who's a close contact, we want people isolating at home. So what we're trying to do is really stop those transmission chains. And this is just one way of doing that. It's all part of that public health toolbox. We manage it from as many angles as possible.
Thank you.
We have a couple of minutes left for 2 or 3 questions. Please proceed.
Hi, Dr. Roussin. This is Danielle from the Free Press. Can you provide the proportion of cases in Winnipeg and Southern Health that are considered community transmission?
Yeah, you know what? I don't have that in front of me. I think we will certainly be able to do that. You know, like usual, we see a predominance of the transmission, occurring within households. That's, what we'd come to expect. It's, somebody acquires it, say, in the community, and then just brings it home, and people within the home are much more likely to acquire it. But we'll try to get you that number.
Thanks.
Dr. Roussin, where are those regional test positivity rates? We haven't had them updated since November 3rd. It's November 10th.
I believe those are being updated every 2 weeks.
2 weeks.
And Dr. Roussin, when you reveal a regional vaccination rate, obviously, especially the large geographical regions, there must be a tremendous variance of test positivity rates within the regions. So are we seeing some very high, say within Southern Health, where the average is quite high? Is there a lot of variance there? Are there some pockets of Southern Health where the test positivity rate is much higher?
We do see variability with both, test positivity as well as vaccine uptake. Now, test positivity, even using a denominator of a region, gives us so much variability, so much swing in those numbers. So when we look at test positivity within a certain breakdown of a health region, it's even magnified there. So they're looking at very low denominators of testing. So the test positivity is difficult, but yeah, certainly absolute case numbers, we see quite a variability, and as well as vaccine uptake.
Just to circle back to the question about schools, Dr. Roussin, you talked about quite a few measures, distancing, mask wearing, all that kind of stuff. Why not rapid testing? It seems like that's part of the province's plan when it comes to the soft mandate on vaccinations. If you're not vaccinated, you face rapid testing. Even teachers are facing that as well. Why not rapid testing of children?
Well, I mean, certainly testing is always an option. We want symptomatic people to still go for testing. We see that, even with that availability, we're seeing absenteeism without testing. And so it is another tool in the toolbox. It's something that we do consider, but it's not the only measure that we need. I think we could certainly try to look at ways to access it, but what we really need to do is reduce that community transmission.
And could Dr. Reimer just maybe elaborate on why the third dose has to be an mRNA?
Yeah, so the mRNA vaccines have been shown to be more effective, and by that I mean they provide longer lasting protection compared to the viral vector vaccines, and they also don't have the side effect of blood clots, which, while very rare, can be quite severe for some people. And so we recommend using the products that are not only the best at preventing a COVID infection, but also the lowest risk for most people. That doesn't mean we don't have the other vaccines available, and there may be some individuals who would need to receive a viral vector, but For the vast majority of Manitobans, we recommend the mRNA vaccines to help protect them against the virus in the best way possible without the potential side effect of blood clots.
Dr. Roussin, the school cases, if most of the transmission is not occurring in school, where are the cases coming from? Is it transmission in the home? Is it transmission among friends or out in the community?
So we do see high levels of transmission within homes. That's just what we've always seen, right? That's the highest sort of risk of transmission. But somebody in that home is acquiring it somewhere in the community. So yeah, so it's at this point with contact tracing, it's difficult to know precisely where people are acquiring it. In schools, we have such a controlled scenario there that we're able to have a pretty good judge of whether there's transmission occurring there or not. Otherwise, yeah, we're seeing it where people gather outside of school, and so again, it's all tied to the transmission rate in the community. High transmission rate in the community. We see a lot of cases in all age groups, but certainly in the younger age groups. Low vaccine rates in the community. We're going to see a lot of cases in all age groups, but definitely school age kids as well.
Dr. Roussin or Dr. Reimer, I'm not sure if you, which one of you would be better suited to answer this question, but ever since, the rate of fully vaccinated people getting infected has gone up compared to the total number of cases each day, I think more and more people, kind of have questions about the efficacy of the vaccines. Obviously, I think a lot of myself and a lot of the people on this call have done a fairly good job of trying to explain, the base rate and things like that. But maybe to hear it in your words would really help Manitobans.
Yeah, so what I would say is that most Manitobans are fully vaccinated. And so if the vaccines were not effective, we would expect most cases to be amongst fully vaccinated people. And that is not what we're seeing. So when we look at the proportions, so rather than just the crude numbers, but actually looking at out of how many people that are fully vaccinated compared to how many people are not fully vaccinated, it's dramatically different. We see much higher risks of infection, much higher risks of hospitalization, of ICU admission in people who are not fully vaccinated. Depending on the day, the numbers vary a little bit, but on an average day, we might see 6 to 9 times higher rates of infection amongst unvaccinated people, and it's much higher than that when it comes to hospitalization. Higher than 10, sometimes higher than 20 times the rate of vaccinated individuals. So the crude numbers can be very difficult for people to interpret, and we get a lot of people who have trouble understanding why sometimes we see high numbers of cases in vaccinated people, and they feel that this may mean that the vaccine doesn't work. But in fact, when you have so many people who are vaccinated, it really does skew that interpretation, and truly the risks are much higher in people who are not vaccinated. That said, we know that it is possible to get infected. It is possible to spread the virus if you are vaccinated. And we've always said that the original trials, while they were incredibly good at protecting against the virus, they were still 95%, which meant that 5% of the time the infection still did occur. So we do want to also emphasize the importance of the fundamentals in people who are vaccinated, even though the risk is quite a bit lower for them of being infected, of spreading the virus, and of having those severe outcomes.
Final question to Danielle.
Oh, thank you. Dr. Roussin, I was hoping you could elaborate on the timeline that you're seeing based on modeling for the healthcare system to be, severely impacted by COVID-19 cases, and just if you could compare to the third wave, how we've seen perhaps a decoupling of hospitalizations from cases.
Yeah, and so, this is what I think most jurisdictions were expecting when we had high vaccine coverage, that we would see that decoupling. So for most of the waves, we would see, for instance, about 2% of test positives would end up being admitted to ICU. We still see roughly that same number, despite the high vaccine coverage. And again, that those admissions are almost exclusively in not fully vaccinated individuals. So we're still seeing about the same proportion of test positives be admitted to ICU. Now, what's making that more challenging is many of those people are only testing for the first time upon admission to ICU. So we've lost that ability to predict for various reasons. So we haven't seen that decoupling, and that's the very reason why we're seeing a strain on our healthcare system. And then the modeling, shows that if the current trends continue unabated, then in the next, even 2 to 3 weeks, we could see numbers that would put added strain on our healthcare system.
Thank you, doctors. Thank you, everyone. This concludes our session.